Welcome. Thanks for joining me today. It's Russ Curtis, professor of counseling. I really love this article, and since I post things on psychopathy and conduct disorder with children, I really do want to focus on what is treatment for children with conduct disorder. This is called regulation-focused psychotherapy, and it's actually non-directive play therapy. And so let's look at this. The assumption made with this type of therapy is that acting out behavior is the inability to express emotions. So we're wanting to give words to these folks. I think there's a lot more to it as well, given the attention that you get in play therapy, given the contact that you get. Helps a person feel seen, feel heard, feel respected, which may not be happening all the time at home. Okay. So it's non-directive play therapy. You're going to do this after you get a thorough history about the child, and you're going to track the child's behavior. They can play with these toys in any way they see fit, as long as they're not harming you or themselves with it. It's okay to break a toy. That happens. But we're going to track the child's play. So we're going to say we're noticing what the child does, and we're saying, you decided to play with that toy. You figured that puzzle out. You're choosing to play with another toy. This is hard, but you're not giving up. So you're doing all that good play therapy tracking when you're doing this therapy. You're making good eye contact. Now, this is going to be critical. Oftentimes children with conduct disorder can get a bad label. And so we want to make sure that we're not seeing them in that light. We want to make sure that we're seeing the potential, we're seeing the resilience, we're seeing the light in the person, if you will. So we want to make good eye contact. We want to form that good professional connection with the children. Termination is actually mentioned early in the process to the child because we're actually wanting them to, I hate to say this, to feel that abandonment so we can then process it. Okay. We're going to give words to the anger and the frustration that they feel. And we're going to do this quote here. I'll just go ahead and read. Consistent interpretation of a child's defenses against unpleasant or intolerable affect introduces flexibility into their emotion regulation system. That's the whole purpose of this play. And so we might be saying things in order to increase the emotional vocabulary, such as, hey, it's hard when someone you're used to seeing goes away for a while. It's hard to have a new sister or brother in the house. And maybe it's hard to use words when you think about sad things or you think about angry things. Helping children recognize also that we can have all kind of thoughts and we don't have to act on them. Thoughts are just thoughts. We get to focus on which ones we want to choose, and we certainly don't have to act on any thought. We get to choose that. That's one thing we get to choose. So practicing these good skills with good non-directive play therapy, which is so healing with folks with conduct disorder, I think can go a long way. I very much appreciate this article. Let me know your feedback on this, and we'll talk to you on the next video. Take good care.